Hi, I'm Dr. Jerry Hesch. I'm an orthopedic manual physical therapist. I treat joints in the body, and I treat the person, and I treat the nervous system. And I have made a career of evaluating and studying joints throughout the body. But my initial interest started out with the sacroiliac joint. And I actually have described 18 patterns of movement impairment that are not described in the literature. My client presents with one of those patterns, but I think first I'll have her just give us a little bit of history. So when did your pain start? Where is your pain? What do you think is wrong?
It started with childbirth, and my pelvis has never felt right since. It was a long birth. It was a home birth, so there was not medical help there. Anyway, afterwards I was just in so much pain, but it was my first child, so I didn't know really what to do or how much was normal, but it didn't seem like that much pain was normal after, like days after and weeks after and months after. So, and I've just sort of been dealing with it ever since.
Yeah. And we've been kind of chasing symptoms with you and chasing mobility impairments. And today you return and pelvis is symmetrical, hips have very nice mobility. And you have good mobility doing passive springing through the pelvis. It gets interesting when I test this movement in the plane of the joint. It doesn't move on either side. I hook the PSIS and I capture more of the ilium and I just follow the plane of the bone, which is also the plane of the joint. You also don't move when I try and spring the sacrum anteriorly. Mm-hmm. Every other direction, I can push to a stop point, and then I can add a little thrust, and it springs, mm-hmm. and it recoils. Okay? So I checked ligament tension, and the two sacrotuberous ligaments feel like bone. They are unyielding. And when I test the lateral sacroiliac movements called the sacrospinous ligaments, they are the same. Okay? Palpation-wise, sacrum looks deeper. And so if the sacrum is pushed forward, as can happen with horse riders or a fall on your back and you land right on your sacrum, okay, it appears that it can move into your body. I don't have a good alternate explanation, mm-hmm. but you having injured it, and women have more mobility than males do, and you could have kind of a unique joint configuration. The shape can vary from person to person. Anyway, a CAT scan with 3D reconstruction would allow us to actually use a printer, a digital printer, and print your anatomy, and you could hold it in your hand. Wow. So in an ideal world, we'd get one of those before I treat you and after I treat you.
Right. That's interesting.
But we can't justify exposing you to a CAT scan. So I want to go forth and treat it. And it's not something I see very often. And the way that I treat it is I put 2x4 by 8 inch foam this way on the ilium, on the hemipelvis, ilium and ischium, on each side, and you lay on your back, and the goal is to let the ilia glide forward and come together in front and separate in the back and allow sacrum to shift posteriorly. So it's a small force, so we have to do it for a long time. Okay. So 5 minutes. Many techniques to move joints are a lot shorter than even a second. Mm-hmm. Manipulation is about 1/3 of a second. So this is 60 seconds times 5, so it's 300 seconds. All right? Tell us what you said about your pelvis feeling wider.
Oh, it feels wider in the front, just as you said, in front, but not necessarily in back, but my hand used to fit between my hip bones, and it does not anymore.
And how long ago, how recent was it that your hands fit?
Oh, not since I had my son.
Okay.
It hasn't fit ever since then, yeah.
All righty. Okay, very good.
But you know what I just remembered? When I was a teenager, 15 or 16 or something, a young, dumb teenager, because, you know, teenagers are...
I was a smart one.
Oh, you was a smart one? Well, I wasn't.
My dad told me. He told me I was smart.
Yeah. Anyway, my cousins and I were up, I don't know why, we were on a lake and we were daring each other. There was this big tower there, and we climbed this tower. It was high. It was really high. And we're, daring each other to jump into the water. And we did. But when I landed, I guess my legs were a little bit separated. I'm not sure. It was so painful. I mean, it almost took my breath away. I almost couldn't swim to shore. I feel like it almost knocked me out. But I was a kid and I never said anything about it, and I never really thought about it after that. But that's possible as far as
It certainly could set things up.
Yeah,
Absolutely.
set things up, yeah.
And when you point to your pain, you point right over the sacrum.
That's where it feels.
You're at the
right there.
mid
Yep.
and upper sacrum
Yep.
midline. Yeah,
That's
or
exactly
on
where
both
it
sides
feels.
actually.
Yeah.
Okay, so let's keep filming, and I'm going to have you lay on your back.
Okay.
Okay, so I'm going to put these in a V. Okay, and then this one also. Good, good. Are you okay with that?
Mm-hmm.
So again, it's under the hemipelvis and the
Okay.
angle of the joint.
Right.
And I'm going to set a timer for 5 minutes.
Okay.
If it gets uncomfortable, then I want you to go ahead and sit up and yell for me. I'm going
Okay.
to go write some notes.
Okay.
See you in 5 minutes, okay?
Okay.
Thank you.
I'm sure you can take it off now.